Thank you so much for your time, Aisha. I think this is a huge move, and everybody's looking at South Africa, not just from the African continent, but across the globe, given the fact that Africa was on the back foot when it came to administering vaccines and the distribution of vaccines, because we just couldn't get our hands on it. What are you hearing and what are you seeing today at Biovac?
So Heidi, yesterday we saw, and as you mentioned, this high-profile delegation led by the WHO visiting a number of vaccine sites here in the Western Cape. We saw them at Stellenbosch University meeting and interacting with some of our top scientists. And of course, our scientists have been recognized already on the global platform. But I'm now joined by the CEO of Biovac, Dr. Morena Mahwana. We had the WHO DG along with other high-profile guests visiting your facility. You had time to interact with them. What did you hear from them about this facility?
Yeah, thank you. I think this is a wonderful opportunity for not only our company, Biovac, but I think for South Africa to showcase what is possible. It's not every day that you get the WHO DG coming to one's country. So I think it's very important that they come and see, unfortunately through the pandemic, but can see the wonderful work that we do scientifically in terms of what the universities are doing, but more on our side in terms of manufacturing capability. So the interaction that we've had with them today was to really show that vaccine manufacturing is real and capable, particularly of COVID-19 vaccine. Whilst there has been announcements that have been made, but we really demonstrated live today that the infrastructure and the capability does exist here in South Africa and at Biovac, and that will be contributing towards COVID-19 vaccines, amongst others.
So what actually takes place here at Biovac?
Yes, so Biovac was established a while ago, even before COVID-19 vaccine, and we've been laying the foundation for vaccine manufacturing. We're focusing on pediatric vaccines, so vaccines against that get given to children. One of the vaccines is against pneumonia. The other one is against things like whooping cough, hepatitis B, and polio. And that is what we were doing in terms of building capability prior to COVID-19. What we are doing now is that we are expanding, and we've announced last year already a collaboration with WHO, firstly, in terms of the mRNA hub, but secondly with Pfizer, where we will be producing the Pfizer COVID-19 vaccine towards the latter part of this year.
So when the COVID-19 pandemic broke, lots of people were talking about, you know, do we have the capability, do we have the know-how? But as you've been telling me now, South Africa has been in the forefront of producing vaccines a long time ago.
Absolutely. So I think what is challenging is the perception that people have of Africa. That, you know, when you pick up a phone and you call, other people in the western parts of the world, they actually don't believe that you have capability until they actually come and physically here, which is something, it's a perception that I think we need to change so that we are known, to have the capability. And that's essentially what happened, that there was doubts whether there's capability that does exist here. But with time, we've been able to demonstrate to many, which is why we've partnered with such large organizations, including the WHO themselves, who were really forging us and encouraging us to do partnerships, and we're really there. So we do need, not only multinationals, but multilateral organizations that can really be able to make sure that we use the opportunity to really spread our wings as a country and really show that there's capability, and I think we have demonstrated that.
Now, you were talking earlier about protecting the cold chain integrity. Are you able to do that in terms of the vaccines that you produce here?
Yes. Now, vaccines, all vaccines, not only COVID, need to be stored under cold chain conditions. So normally we would have fridges that are under 2 to 8 degrees. That's a normal standard way. So vaccines just don't, you can't just put them just anywhere else. They need to be in a fridge, first and foremost. COVID-19 has brought a bit of a challenge in that some of the vaccines get stored under minus 20 degrees and minus 70, which is the ultra low storage freezer conditions. Now, we were quite intimidated, at the start when these conditions were there, because we needed to learn. But I'm very happy to say that, we are very capable. Firstly, we've been able to distribute vaccines under minus 70. But secondly, Biovac is building what we call a freezer farm. And the freezer farm will be able to hold minus 70-degree fridges, which means that the capability does exist here and will be existing for much larger capacity going forward.
Thank you so much for your time, sir. And that was Biovac CEO Dr. Morena Mahuana speaking after hosting the WHO Director General and also other international guests here at Biovac in the Western Cape.
Great. Thank you so much for that update, Aisha. I think it's a very important one, just seeing the capabilities that South Africa actually has.